affordable healthcare system is a necessity, not a luxury, and same is the situation in India at this moment. There are a lot of policies being implemented by Government of India. Let's discuss about the same with Dr. Hrishikesh Pai. Today we have Dr. Hrishikesh Pai in the house, so let's discuss with him. Doctor, I just want to know about the new policies being implemented by the government, making the healthcare facilities to be more affordable for the common public.
No, basically, the country is a large country. It is nearly 1.3 billion population, and the density is nearly 400 per square kilometer. If you compare it with China, the Chinese density is only 150 per square kilometer. While in United States, the density of population per kilometer is just 36. So India is got a lot of density. We have done a lot of, over the last 60, 70 years after independence, we have done a lot of progress. A lot of governments have spent a lot of money on healthcare, a lot of projects have been done, and they have really improved. For example, maternal mortality rate, which was 350, has gone to nearly 160, and the target is that by 2020-22, we will go below 100. So government is putting a lot of effort on maternal and child health, where a lot of concern, nearly 50% of India's population is mother and child. So in order to find out whether there is an impact of health in our country, we have what is known as National Family Health Survey. First survey was done in 92, then 98, then 2005, and the final survey was done in 2015 recently. And the parameters of the survey are very good. There is a decrease in the infant mortality rate. There is an increase in the sex ratio from 914 to 919. More households have been covered for basic things like sanitation, and also overall the survey shows that India is slowly progressing, and more people are covering under health. Unfortunately, the government spending on healthcare is 1% of the GDP.
Correct.
So, in like a lot of countries, the healthcare spending is 7%, 8%, 10% of GDP. However, the Indian government has assured that this year the health spending will be increased to 2.5% of the GDP.
So I think India is the only country where there is no public healthcare sector as such, and only private sector is booming as of now.
Yeah, but public healthcare sector is there. It is silently working. However, of the 4 lakh crores of spending that was done on healthcare, 2/3 of the spending, nearly 3 lakh crores is being spent by private people, right, and 1 lakh crores have been spent by the public people. However, this spending is slowly increasing. What I propose is that we must integrate the system. We can't expect government. Government has got limited resources. We have to spend on defense, we have to spend on agriculture, we have to spend on illiteracy, picking up the people, we have to spend on water, food. So many parameters have to be decided at the same time. So we in private have to join the government. There is no point in blaming the government. Government is made up of us only, na?
They need to be compliant.
Yeah, we need to have compatibility. We need to have complementation with each other. There should be no overlap. If suppose something government can give it to the private sector to show it, that same thing the government should not do. So there should be integration of resources. And as I was saying in my talk, that we need logistical support. More and more roads, the last mile is very important. More and more roads need to go to the villages.
True.
We don't need to create primary health center at the village level. We need to transport the people. See, in even United States, there are certain states where there are mobile clinics. So if there is a mobile ambulance, by the time they pick up the patient and they bring him back to the district hospital, the treatment has started in the ambulance itself. So the mortality is brought down. So that kind of mobile system needs to be done, but it will all depend on the road. So correct. Our transport minister has to see that the road goes to the last village. Once that connectivity is done, it's a huge country, so it will take time. But as you know, that the road ministry is doing a rapid job, and so what I feel is that I personally feel that governments are doing a lot of work. We as common individuals, we should also help the government. I believe that out of the 1.3 billion people, 900 million to 1 billion people are poor. For that, our private doctors should do at free work or at very less cost. We should do discounted work. The remaining 300 million who are well off, we should let the market decide the charges, like any other democratic country.
This is one aspect of it. Right now, due to the demonetization and GST implication, there are a lot of havoc going on in the health healthcare sector also, apart from the other sectors. So how you would like to address that particular aspect?
No, I think that it's just a minor thing. It will pick up. Everything is getting picked up. In my practice, I have now found that the spending has started increasing again. So India is. I was telling someone that we have been. Our civilization is there for 2,000 years.
True.
We are the most fertile country in the world, and this country is holding 1.3 billion. Imagine, 330 million is the population of USA. So we are a large country, so the impact, the change takes more time, more resources have to be spent. What is small countries like Malaysia and this and that? I mean, they are spending 7% because they are small countries.
Correct.
Our 1.1% of our GDP is a huge amount of spending, but
There's a lot of volume, actually.
unfortunately, it gets diluted because of the population. So one of the important things in the future is to regulate or control some amount of population. Of course, reproduction is a human right. You can't go against it. But I feel that we have also got duties towards the state. And after 2 children, we should regulate ourselves. This is very important. The National Family Planning Policy also it is known as Vision 2020 of the Government of India, where they want to cover 58 million couples with family planning methods by 2020.
Apart from that, there is a lot of
It's been part of many government schemes.
Really? So you have been part of a lot of government schemes as of now. So can you actually tell us a way to actually bridge the gap between the government sector as well as the private part of it? How they can make a synergy?
Right. So now one of the scheme that the government has started this year is the Pradhan Mantri Surakshit Matritva Abhiyan. That is called a PMSMA scheme, wherein a pregnant woman on the 9th of every month can go to a particular designated facility, and the private doctors will go to that facility and examine that patient free of charge.
Okay, that's
so
cool.
This is and a lot of like our Foxy, which is I am the Secretary General of the Federation, and nearly 1,500 private doctors have volunteered for that program. So this is just one of the many hundreds of schemes which the government has got. What we need to do is that I feel that we need to have a overall response center where anyone can, by using an app or using a telephone, can access a call center which should be huge, maybe made up of 2 lakh, 3 lakh people, and they should, once that call is taken for health, they should refer that patient to designated centers all over. So at least their people know where to access what.